I think the general public thinks of Candida and yeast infections as the same thing, in the sense that only women can get them when they have vaginitis. Is that true? And what are some other symptoms of patients with Candida overgrowth? And is vaginitis a symptom of a gut overgrowth of Candida?
Yeah. It's funny. My biggest supporter and my biggest critic is my mom still. God bless her. She's 80. I shouldn't say her age, but she's in her 80s. And when I told her I was writing this book, Conquering Candida, she said to me, "You can write a whole book on about women's vaginal yeast infections." I said, "Mom, it's not really all about just that." So, I also really 25 years ago when I read Dr. Crook's book, because it's funny, I read it and put it down for a while. My wife Ricky was doing a lot of the work in that area because she was seeing a lot of the women in our practice. I did also think Candida only happened in women who had vaginal yeast infections. Although I did start to see, obviously, men with AIDS that had thrush in my practice. But, I always tell a funny story in my practice too. My wife and I, for a while we worked in different offices and then we kind of merged. And I was doing early in my career a lot of classical allergy, and occasionally I'd be treating a patient for some type of condition, asthma or sinus, and they would say, "Oh, I see your wife does like nutritional medicine. Can I see her?" And I said, "Yeah, why not?" And sometimes they had like weird rashes or unusual symptoms that they probably didn't even tell me. And then, they'd be seeing her and I hadn't seen them for a while. I'd see them in the waiting room and they'd be smiling and they go, "Oh, Dr. Mitchell, thank you so much for letting me see your wife." I'm like, "Okay, what did she do?" And then I'd find out. And then I'd say to my wife, Ricky, especially with a guy, she goes, "Dean, he's got Candida." I go, "What?" I mean, it didn't really register back then. But boy, when the more I ended up getting to functional medicine and opening my eyes and recognizing these patients that I was missing, especially with the chronic sinus patients,
Yeah.
that so many of them, it's due to Candida. And I always tell patients they get a little bit of a smile because I always love to go back to my medical school days. I remember when I was in pathology that when they used to do the slides where you look under the microscope to see the different tissue, that the vaginal tissue and the sinus tissue were almost identical. They used to try to fool you which one was which. And it turns out also the microbiome are very similar, believe it or not, in some ways. So this started really changing my mindset, how to look at this condition.
Yeah, the chronic sinusitis, being, yeast problems is very interesting. And I do think it's still way
It is. Yeah.
underdiagnosed.